opäť na kanáli Esteholik. Dnes vám ukážeme estetický zázrak. Teda aspoň dúfam, že sa nejaký na tejto tvári odohrá. Dnes vám totiž ukážeme procedúru, jediný typ neinvazívneho nechirurgického liftingu. Možno si hovoríte, že zázraky nemajú nič spoločné s vedou. To je síce fakt, ale práve túto terapiu podporila a aj stvorila veda. Nachádzame sa na klinike Biothecare Estétika v Bratislave a o chvíľu nám aj o tejto procedúre porozpráva viac pán doktor Moatazom Alfaresom. Ale ešte predtým si vysvetlíme, o čo vlastne ide. Jedno z najmodernejších omladzovacích ošetrení, ktoré si každoročne a niekedy i dvakrát do roka doprajú hviezdy ako Jennifer Lopez, Jennifer Aniston či Gwen Stefani. Pretože po 40-ke sa už netočí všetko len okolo objemu, ale najmä okolo pevnosti. Ultherapia funguje na princípe ultrazvukovej energie, ktorá sa pomocou špeciálnych koncoviek aplikuje do hlbších vrstiev kože a podkožia, ktorým sa hovorí SMAS, superfaciálny aponeurotický systém, pričom povrch pokožky ostáva neporušený. Ultrazvuk prehreje a v podstate tepelne poškodí kolagén a v dôsledku toho nastane kolagénéza. To je proces, ktorým sa nahrádza starnúci kolagén a stimuluje tvorba nového. Výsledkom sú vypnutejšie kontúry tváre, podvihnutie obočia či spevnenie krku a dekoltu. Ultherapia je jedinou FDA schválenou formou neinvazívneho liftingu, ten chirurgický však samozrejme nenahrádza. So good afternoon, Dr. Alfares.
Good afternoon.
You are here in Slovakia operating for already six years.
Absolutely, that's right.
But for your comfort, we will talk in English.
Thank you.
So, Ulthera is a device. Ultherapy is the name of the treatment I will undergo at your clinic today. Why is it so special?
Okay. Ulthera, as you mentioned, it's so special because it's different than other devices, like they use the same technology, but Ulthera is special because of two major things: effectivity and safety. Ulthera is the only device that it has two ultrasound. One ultrasound, you can visualize everything, so you know exactly what area you're treating, and you can avoid all nerves, arteries, everything, and you can know exactly where you are clicking, where you are targeting, SMAS or whatever skin. Okay, so it's effective because you're targeting the specific area, and safety because you avoid everything else.
Yes, as you said, it's actually a microfocus type of ultrasound, which means that you can target it exactly where we need it. So how do you choose exactly the depth of action and the temperature?
Excellent. So this is the second ultrasound. The first ultrasound you see, it's like it gives you visualization. The second ultrasound, it's microfocus ultrasound. So you see through the first ultrasound, you see exactly, you can assess the patient, what the depth, because every one of us has SMAS, but the depth of SMAS is different from you to me to her, like everyone is different. For example, for me, I need 4.5 milli, for you, you might need 3 milli, for other people 1.5 milli, so this is how you treat the patients.
Okay, great. And speaking of the device, how to recognize actually the real Ulthera device, and how does it differ compared to others on the market?
As you mentioned, Ulthera is the brand name of MERS aesthetic. So Ulthera, it's only one Ulthera in the market. There's no other Ulthera. They're Ultherapy, which is like treatment, okay, which they don't have the same feature and benefit of Ulthera. So I think very easy if any patient called the clinic who wants to get this treatment and ask them if they have Ulthera, okay, and they can see the device itself, like when they go, it's written Ulthera. Ulthera is a brand name for MERS, and this is the only device.
How will I feel during the treatment? Will it hurt me?
Like this is really, it's you feel the energy in specific places, of course, but the comfort, it really varies, like from patient to patient. Like everyone can tolerate more or less, like it's really a big difference.
Yes.
But in general, whatever you feel, those discomfort, it will be only during the treatment, and after that, nothing.
Okay. What is the onset of effect after treatment?
Again, it depends on the patient and the collagen existent in the patient, but usually from like 2 to 6 months. Like up to 6 months, you still see the benefit of the treatment.
Mm-hmm. And is it necessary to repeat the treatment?
For vast majority, like it's only one-time treatment, but for some patients, you need to do like retouches after a while, and it's recommended to do like retouches every 1 year, like retreatment to see that to maintain the results and even improving the results.
Mm-hmm. Can there be any side effects?
Side effects, like almost rarely, because if the applicator, the doctor who's treating, they know the device, they know how to use the technique, it's very rare. But of course there's like redness sometimes, swelling a little bit, bruising sometimes, but this is like stay for like few days and disappear.
And from who is this treatment not suitable? For example, can people with a metal braces go through it?
Usually every patient with severe like skin lesions or like open lesions on the skin, severe cystic acne, for example, those not recommended. Patient with like pacemaker, like implants, like pacemaker, defibrillator, those not recommended. Patient with metal implants on the treated area, it's not recommended. But I know like some patients, like because the only like here like warning is like to feel the heat on the metal implant, but if the patient doesn't feel so, even those they can be treated as well.
I understand. And what about the combination of Ultherapy and fillers and botox? Can actually the treatment disrupt those?
Usually it's like if the patient treated with filler and botox, we have to wait 6 months. Even Ulthera, it doesn't affect the hyaluronic acid or botox, but it's recommended to wait minimum 6 weeks. Okay, then we can do the treatment. But after Ulthera, even in one session, we can do Ulthera treatment and we can do botox and filler.
Yes. And for whom, on the contrary, is it suitable? Who is the right for Ulthera?
Big range of people it's suitable. Laxity of the skin, sagging of the skin, like under the chin people when they have. Usually it's Ulthera, it's invented to treat, it's not for facelifting. It's intended to treat people with 30 years old and older who has moderate to mild skin laxity. So it's tightening the skin, increase collagen and do lifting. But for older people who doesn't want to go, because like older people with too much sagging of the skin, those like it's indicated for plastic surgery. But if they don't want to undergo surgery, Ulthera, it's a good choice for them as well.
Yes. And we decided that I also belong to this group, so are we going for it?
Podeminato.
Takže takto to vyzerá po ošetrení Ultherou. V podstate som cítila iba teplo, ale nie je to nič hrozné, dala som si aj 2 tabletky proti bolesti a v podstate by som mohla teraz spokojne odísť, odkráčať a pokračovať ďalej v živote bežnom. Takže vám ďakujem veľmi pekne, pán doktor Alfares. Thank you very much.
Most welcome.
And I wish you a lot of happy clients.
Thank you very much.
I definitely will be one of them afterwards.
Happy you like it and you enjoyed it, and you will see the results. Like, you have to come for control like 1 month, then again 3 months and 6 months, and we can show you the results before and after.
Thank you.
Welcome.
Takže ďakujem veľmi pekne aj za vašu pozornosť. Presne ako povedal pán doktor Alfares, ten účinok sa ešte objaví v podstate s pribúdajúcimi mesiacmi. Určite to budem sledovať, určite vás to budem informovať. Zatiaľ ďakujem za pozornosť. Želám vám krásnu a zdravú pleť ako vždy. Ahojte.